So welcome to our lab practice today, and our first subtopic is first aid in the laboratory. And our objectives are, at the end of the lesson, we must be able to define what is first aid and also the role of first aid. The second objective will be able to describe most common first aid injuries. And our last objective this evening is to outline first aid essentials. So then, to start off, let us first of all define what is first aid. And first aid, we define it as the initial treatment given to a sick or injured person or individual before professional medical care becomes available with the materials at hand. And such interventions aims at reducing the situation that threatens the victim until a professional arrives. First aid is required in many ways, that is, shapes and forms. It is always a good idea to have basic first aid skills, just in case you need it yourselves or someone needs it around you. Then there is just a video there which I may play. It's talking about first aid.
First aid in the workplace. First aid requirements vary from one workplace to the next, depending on the nature of work, the types of hazards, the workplace size, location, and number of workers. These factors are taken into account when deciding what first aid arrangements and facilities need to be provided, along with adhering to the Australian Resuscitation Council guidelines and the relevant state and territory legislation. When they are developed, policies and procedures for first aid in the workplace take into account relevant legislation.
In short, it is talking about first aid, the role of first aid. We shall not listen to all of them. Let us move on to most common first aid injuries. And our first one, we have cut. That is, if there is bleeding, press firmly over the side with a clean cloth until it stops, anywhere from 3 to 15 minutes. Clean with the lukewarm running water and gently pat dry. If the skin is broken, apply a thin layer of antibiotic or ointment. Then cover with a bandage or gauze or adhesive tape. If you can't control the bleeding after several attempts with direct pressure, call your pediatrician or head to an emergency room. Then there is also that is a burn. Number 2, immediately hold injured under cold running water or apply a cold wet towel until the pain subsides. Cover any small blisters with a loose bandage or a gauze and tape. Call a doctor as soon as possible if burns are around the face, hands or genitals, or if they are larger than a quarter-inch anywhere on the body. If the injury looks rooted, go to the emergency room also for a burn covering attend. Number 3, insect bite. In case you are bitten by an insect bite, if the insect has left a stinger, gently scrape the skin with your fingernail to remove it without breaking it. Refrain from using tweezers because that can squeeze more venom out of the stinger, causing further injuries. Call 911 if you have trouble breathing, coughing, or develop a hoarse voice, hives or swollen lips or tongue. To combat itching, apply 1% hydrocortisone cream or a topical histamine if the skin isn't broken or scabbed. Contact your doctor if you suspect a thick bite. Number 4, fractures. In case of fractures are broken bones and they can occur as a result of falls or other harsh impacts. When this happens, the affected part should be immobilized and additional manipulation of the affected area should be avoided. Remember that a fracture could sever a blood vessel or a nerve if it is not immobilized, resulting in a much more severe injury. Immobilize the injured part and transport the patient to the nearest hospital or medical clinic as soon as possible. The next one is let's look at first aid essentials. What do you require when carrying out first aid? You need adhesive tape. Number 2, bandages in different sizes to prevent movements at dislocation points. Number 3, elastic bandages, gauze rolls and pads. Number 5, alcohol wipes to clean scissors and tweezers. Allergy medicines, e.g. oral and histamine for allergic reactions. And the aloe vera gel are some of the essentials you require. So there's also antibiotic ointment to prevent infection, calamine lotions in instant cold packs used to compress to control swelling, hand sanitizer. That one helps to clean hands in case water and soap aren't available. Then saline wound wash, bottled water to rinse wounds if there is no vessel nearby. Then 1% hydrocortisone cream for bites or stings. Then that
Hello, Mwalimu.
makes our
Mwalimu, I have a question.
Yes.
Okay, I was suggesting like in the next lesson,
Okay.
if we could do like a practical lesson about first aid. I think it's essential since it affects us in our day-to-day activities.
Okay.
Yeah, put that into consideration.
Okay, we shall try next time to cover that one. Then in our next class, let us take away this assignment. Home assignment. We will discuss different ways of carrying out first aid, so that we can, when we meet, we can discuss as well. Unless somebody has a question. Yes. Any comment?
Okay, Malim.
Yes, sir.
Yes, I think the lesson was done well,
Okay.
and I was able to just get something out of the lesson,
Yes.
and I will be comfortably be able to teach given us.
Yes.
But my question is, will we do it in a group or just individual?
Can you clearly, please?
Okay, the assignment is given. Is it individual or we do it in group?
The assignment, we are just doing in a group, and we will discuss when we meet in the next class. Is it clear?
Yes.
Any other question?
Individual, yeah?
Not individual, in groups. In groups of 5.
Okay.
Yeah.
It's okay, it's okay.
Any other question? Okay, thank you for your time. You have a nice evening.
Okay.